REACT consortium aims to strengthen the capacity of health workforce and health system to respond to the impacts of climate change. As part of the baseline phase of the project, we recently completed several activities including surveys, qualitative research, a scoping review, and a policy review. As we all know that Nepal is vulnerable to climate change. We have been increasingly facing floods, landslides, disease outbreaks, heat waves, and several other impacts on health and health system as a whole. At the same time, government of Nepal is also committed to respond to these impacts of climate change through several policies as well as international commitments. In this given context, we wanted to understand through this policy review how health and climate are reflected in different policy documents and how these support the resilience of health system and health workforce as a whole. We adopted Walt and Gilson policy triangle to conduct the review. So this framework enabled us to analyze the policy in 4 key domains: policy content, policy process, policy actors, and policy context. So altogether, we reviewed 49 policies across federal, provincial, and local governments in Nepal. We validated our findings through key informant interviews with policymakers and other relevant stakeholders. We observed that these policies are recognizing climate-sensitive disease, disaster preparedness, surveillance and early warning system, health workforce development, and equity and inclusion consideration within the broader policy processes. We also observed several gaps during this policy review process. First, while the policy are very strong on paper, they remain a challenge in terms of implementation of these policies. From our interviews, we found that policies are communicated to the subnational level, but there is a lack of clarity in terms of roles and responsibilities, resources to implement those policies, and a strong policy guidance for implementation. Second, we found relatively limited attention to health workforce in these policy documents. Third, there were challenges related to coordination across federal, province, and local government. Nepal's federalized structure provides these opportunities for localized action. However, it requires clarity in terms of roles and responsibilities, clear allocation of resources, as well as accountability mechanisms for each of the government to implement these policies. The findings helped us to understand the policy commitments, the implementation realities, the complexities, as well as the opportunities for us to strengthen the climate resilient health system through REACT. We will use the findings from policy review alongside our findings from surveys, scoping review, qualitative research to inform the next phase of the REACT research.